patients ask why we recommend assisted hatching, they don't really even understand what it is. So let me first explain. Every egg has a sort of a shell, which in people is not a calcium like it is in chickens, but is a protein, clear, proteinaceous covering that surrounds the egg. And then once the egg is fertilized and begins to divide and become an embryo and grows and expands even up to a blastocyst, it's still within the shell. And it's not until the end of the blastocyst stage that the blastocyst makes a little hole in that shell and actually hatches out, just like a chick would hatch out of its egg. When we take these eggs and bring them into the laboratory, to some degree, that shell gets harder than it does in nature. And that's also true of embryos that have been frozen and then thawed. That can sort of harden the shell. And all this makes it more difficult for the blastocyst to hatch its way out of the shell. Our embryologists can very carefully, using a laser, make a little slit in the proteinaceous shell that covers the embryo and just make it easier for the embryo to get out. This also increases some of the communication between the mother's womb and the developing embryo before it hatches, and of course makes it easier to get out of the shell to begin with. We generally recommend this assisted hatching for anybody who's over the age of 40, for any eggs that were previously frozen or embryos that were previously frozen. Of course, if one is doing pre-implantation genetic diagnosis of some kind, then the hatching is automatically done because you have to make a little hole in the shell to go in and get some tissue of the trophectoderm, so you can do that analysis as well. In general, we think this is an important step to help further increase your chances of success. And if we feel that's true for you, we will recommend it. Thank you for listening.